Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you. Welcome back to another episode of Let's Talk About the POTS Life. Today I have an exciting guest with me. Dr. Bluestein is with us, and I'm sure you've seen her on social media. If you haven't, algorithms work. You'll be seeing her after this. So welcome, and thank you for joining us.
Thank you so much for having me. I'm excited to talk to you.
Yeah, so share a little bit about, I was saying before we got started, POTS, EDS, hypermobility, the algorithms work, and we all end up on everybody else's pages, and we see all that. But I just feel like your voice, your story, and what you're doing, and she has a podcast, and we'll get into all the things. But, everything you're sharing is just... it's so needed in this space. And I always feel like the more voices we can have and connect, and, it just makes the whole picture even better. So yeah, why don't you start sharing a little bit about you and your story, and then we'll kind of dive in.
Great. So like so many people in this space, I had lifelong medical problems that were undiagnosed. And I would tell my doctors, I think there's something wrong with me. I don't seem to heal very quickly. I get injured really easily. And I'm kind of fast forwarding to when I'm an adult, of course, when I'm a kid. I didn't know how to say those things.
No, you think because I was the same way. I just thought they were quote unquote normal. So you don't realize these things till you get older.
Right. And you think that it's normal. Every time you stand up for the black shades to come in and feel like you're going to pass out. You think, oh, that's just normal. Everybody does that. So I was working as an anesthesiologist for 2 decades and started getting more and more health problems. And I had a Tarlov cyst, which is basically it's a cyst of the spinal nerve roots, and they compress this other surrounding nerve roots. And I was reading about Tarlov cyst, and I came across this single sentence that said people with Tarlov cysts have a higher incidence of having connective tissue disorders.
Oh my goodness.
Now, mind you, I'm in my 40s at this point. I've already been working for, quite a while, probably even late 40s. And I thought, that's really interesting. So I started looking up connective tissue disorders, came across hypermobile EDS, and I thought, oh my gosh, this explains my whole life.
So
now, probably everyone
much.
else right now. Yeah, everyone else is like, yes, me too. So many of us, we've figured out for ourselves, right? And so I ended up having a large cyst inside a bone in my wrist, and ended up having bone grafting surgery. And I was never able to go back to the OR after that because I ended up with CRPS and other complications and spitting sutures and all kinds of problems and a lot of weakness. And I already had ulnar nerve transposition surgery in that same elbow, and I had a very unstable shoulder. Well, that's my airway arm. So if you can't manage an airway safely...
That's important.
Yeah, very important as an anesthesiologist. So I was like, oh, what am I going to do now? So I had learned so much about POTS because of a very close family member that had very serious POTS. And I had learned a lot about EDS because I started exploring what can I do to help myself? And I thought, well, I'll write an article about it. So I was invited to write an article for a CME journal and wrote that article. And then people started asking me where can I come see you? And I had to initially say nowhere. And then Dr. Pradeep Chopra, my colleague, talked me into opening a clinic, which I did late 2017. In fact, it's funny because he kept telling me, you're ready. And in hindsight, it was actually pretty quick, but at the time I felt man, it's taking me a long time to do this. But of course you have to do a lot of things in order to establish a new clinic. Yeah. And then I started a podcast. I started my first podcast, and then I started Bendy Bodies in 2020. So I've been doing Bendy Bodies since 2020, and we just published about 2 weeks ago, or maybe even less, our 200th episode.
I love that because I always say, personal stories, I just, you relate on a different level, or listening on the other side. I just feel like listeners can connect in a different way. So it's, that alone is just so cool. But if we back up, it makes so much of what you said makes sense. I mean, I'm the same way with hypermobility and scars not healing. And, they say, oh, you're just stretchy or different things. And it's not until later on when you're like, wait a minute, this doesn't add up. And then, you research or the POTS realm and all these things start falling into your lap. Was it overwhelming? Were you like, what now? How did I not know this? What did you think?
Yeah, afterwards, I was like, oh my gosh, how did nobody figure this out?
Right.
Because I went to Mayo Clinic and I had my ulnar nerve transposition surgery there. And when he measured my elbows, he measured both of them and he said,
Right.
you have like 20 plus degrees of elbow hyperextension. And by the way, you're going to lose that when we do the surgery on the left arm, but no big deal. You don't really need that anyway. But he never said like what that might mean. Maybe he didn't
Right.
know. And I had a PM&R doctor who kept telling me, wow, you have a really hypermobile neck. You have a really hypermobile spine. You have a really hypermobile this and that. But again, never said what that might mean.
No, they just, or I always, I'm doing air quotes, but that you're like the party trick person or like, oh, that's a
Which I
little
was.
weird.
Yeah.
Yes. See, it's
Yeah, I was. I
always
did
that
tons of party
way.
tricks. Yeah.
Yeah. It's like, wait. And I had a really well-known knee surgeon in our area, and he specializes in PCL. And I was on my clinical, and he happened to be there at the same place. And he said, wow, I've never seen knees like that because they were so hyperextended. And at the time I thought, well, that's weird. I'm not sure that's good. Now I'm like, oh, well, that's not one you want to hear. But it is.
Right.
It's these little things that, are kind of missed along the way, or it doesn't scream red flags. But when you look under that umbrella, it makes way more sense.
Mm-hmm. Yeah.
Now,
definitely.
when you opened your clinic, obviously, tell everybody, give them all the information, how they can get to you, but types of things that you see there or specialties and things like that.
So I opened my practice in 2017, and then we all know what happened in 2020.
Right. Then things went south.
Yeah. So I moved from my initial space to a bigger space, and it was a really nice space, and not fancy, but it was nice. It was very sizable. And my husband was retiring from his urology practice, and we were going to look to move, and the pandemic happened, and it was like, okay, well, we're moving anyway. My rent was pretty expensive, and I thought people are flying in to see me. Like, people can't fly in to see me. I can't in good conscience ask them to fly in to see me. They were changing the rules and allowing more virtual care. So I canceled my lease, and I originally shut down my practice, which was Wisconsin Integrative Pain Specialists. And I reopened just a few weeks later as Hypermobility MD. And initially everything was virtual. Then when I moved to Colorado, became, more in person. And now my insurance requires that the first visit with a new patient be in person. So, you know how medical licenses are, they're state dependent.
Yes.
So I have licenses in Colorado and Wisconsin. So I have to see somebody that's going to be a patient. I have to see them in person for the first time and once a year thereafter. So I really encourage people to become a client instead, because you don't have to travel. You don't have to get a hotel. It's a lot easier for them. And I feel like they can gain not necessarily as much, but usually they can gain a lot from doing one-on-one sessions, either with me or with my physician assistant, Rebecca Gluck. And we can give them lots of ideas of things that, if you were my patient, I would do this. I don't say you should do this because they're not a patient, they're a client.
Correct.
But I started doing that in the summer of 2022 because I felt like there's still all these people that need help. Somebody has to do something. And I thought, well, if I do this like online coaching, maybe that's a way of getting people better access. And it's still expensive because it's one-on-one, but it's less expensive than
travel.
And actual medical care. Yeah.
And it's a way, we talk about all the time that obviously sometimes they can't travel, or financially, right? Like, it's bigger to come there, or, their location couldn't be further from you. And this is just a way to extend that care and take away that barrier. And I think that's with these diagnoses, obviously post-COVID and traction and all the things. And, people are learning more and more. There's not enough. You can't be everywhere, right? You can't be in all places. And this is a way to extend that and take away the geographical barrier, which I love.
Yeah, I've spoken with people from so many different countries. I do have some patients from different countries besides the U.S. also. But this is a way of getting information that they need into their hands so that they can take the next steps. Because I think that's the hardest thing for people. They get there's information everywhere nowadays, right?
Right.
We have an abundance of information. But getting credible information and getting some kind of assistance with next steps seems to be what people need the most.
And I think validation, I think that's what, I say, I hope even this podcast and all the things we do, I hope validation to be like, you know what, that is me. Or, she does understand and she does get it. And I think that's huge. You're able to do that, like you said, in different countries and get that info, because a lot of times people are just looking, yes, validation, but okay, now what? What can I do? How can I move forward? Or, somebody to help put the pieces together. Not only do you have that from the medical side, but also the personal knowledge and experience that you have with it.
Yeah. And people will say to me all the time, you've probably never heard this before. And then they tell me something and I'm like, I've heard that before.
Yeah.
Of course I hear new things, but
yes.
I think people also like knowing that they're not completely alone. They're not crazy. Like other people have gone through this and they've survived. But not everyone. I mean, some people end up obviously very, very seriously ill, and there are people that have passed away from these conditions. So it's really, really important that people know what they can do.
Yeah, and what they can, how they can access. Like you said, there's a ton of information, but I love how you say credible because there is so much out there, but these credible sources and the way to consume it. I mean, everybody's consuming through their phone and the internet. And I just feel like the podcast and obviously everything that you show via Instagram and the things, like it gives them that credible perspective. I mean, there is so much out there. When you are talking to somebody, are there things, because we have a ton of parents listening, and I feel like obviously listeners of all ages, but a lot of parents reach out and be like, hey, my kids are struggling, or classic signs that people can look for that, hey, something's not right, or especially children, parents are picking up on things sooner, but I think they're questioning themselves like, is that normal or is that weird? Is there anything that you say, hey, these are the couple signs that I say, if you're seeing this, maybe go get something looked at?
Most definitely. So I would say one of the biggest red flags is chronic pain. I mean, a 5-year-old should not be telling you that they're in pain every day. That is not normal. No. I can't tell you how many adults that, we go through the timeline and they'll be like, yeah, I didn't know when I was 5 or 8 or whatever. I didn't know that it wasn't normal to be in pain every day. And of course, oftentimes people are told, oh, you have quote unquote growing pains, which is not a medical, like what, what are you talking about? Yeah.
What does that even mean? Yeah.
What does that even mean?
Yes.
So a definite red flag is if your child is regularly saying that they have pain, whether it's abdominal pain, joint pain, muscle pain, headaches, any kind of pain on a regular basis, children should not be in pain. So I'd say that's the first thing. The second thing is if they seem like they have joints that are unstable or muscles that are weak, or they have, recurrent injuries or difficulty, doing things that other kids can do easily. They're spraining their ankles, they're, subluxing or dislocating their kneecaps, things that other people just are not experiencing. Those would be other red flags. So from a musculoskeletal standpoint, I'd say the biggest things are pain and joint instability. Those are the most important. Kids can have more hypermobility than adults. And of course, hypermobility really means greater than expected range of motion compared to, the standard population for your age and gender and all of that really is what we should be looking at. But a lot of people don't recognize the fact that kids are just naturally hypermobile, especially boys before they go through puberty, because when they get to puberty, then they get less hypermobile. And in general, females get more hypermobile after they hit puberty. But anyway, so I'd say joint instability is a way more important red flag than joint hypermobility. If a kid has joint hypermobility, but no pain, no problems, like that's, that's more like a green flag type situation.
I mean, right. A different type of situation, right?
Yeah, you want to be aware, but so I'd say that's the first kind of set of like musculoskeletal things. And then the next thing I would say is more constitutional. So it's not normal for a 5-year-old or an 8-year-old. I don't know why I keep picking 5 and 8, but anyway.
It's funny because those are my boys' age, so they're perfect examples for me.
That is funny. To be fatigued on a regular basis. I mean, of course, they can be tired sometimes, and I'm glad I don't have little kids nowadays. My kids are in their late 20s, but maybe if they snuck their iPad and they were watching it all night long or something, then they're going to be tired. But like on a general average day, like children should not be fatigued. They should not be struggling to keep up. They should not be complaining that they're dizzy or that they feel like they're going to pass out. I mean, those are not normal things.
No.
So if they're complaining of those kind of things, or you notice that they seem to have heat intolerance, like they do not tolerate the heat very well. Again, if they're otherwise perfectly fine, but they don't tolerate heat very well, like, okay, I wouldn't get too worked up about that. But
if you're seeing a few of these,
right? If you're seeing a few of them, it's all what's medicine? It's pattern recognition. That is literally what we do. So so those kind of things. Then from a mast cell standpoint, are you seeing rashes, hives, itching, eczema, asthma? Are they having food type reactions, again, migraine, things like that. So there's a lot of things that you might observe in your kids, or they might be telling you about. Most kids feel pretty good. They should feel pretty good when they're a kid. So if they're not feeling good and they're not acutely ill, then that's something to be aware of. And also, speaking of being acutely ill, if they seem to get sick more easily than other kids. So a lot of people with these conditions, they have an underlying immune disorder. They can have secondary mast cell activation syndrome due to like a selective antibody deficiency or something like that. So if they are getting sick more than you think that they should, or more than their peers are, then that's another thing to be, flagging.
Yeah, it's always those things, right, that don't quite add up. Or I always say, like, your spidey senses, like your mom's senses, your parents' senses, to be like, something's off here. And it is. And I think it's also hard to see. My older son has hypermobility, and there were a lot of things not adding up, like the fatigue part. And I just thought it was him. And then my second son, I'm like looking at them, I'm like, one isn't as tired as the other. And you do, you can see that, and then, go and obviously, luckily being in the realm that I'm in, picked up on things a little more. But, looking back, even my mom watching now, like she'll say things like, oh, you did. I did when you said the sliding kneecap dislocating. They were like, this is your injury. I'm like, that's weird. I'm athletic. I'm, different things adding up. And it's like, if you're already seeing those things as a parent, or you're listening and you're like, that sounds like her, that sounds like him, definitely go and have it checked, because the sooner, you get on to these things, right? There's a plan. There can be a plan.
Yeah, definitely. And I do want to point out, with the joint instability, we're talking about atraumatic joint instability or disproportionate injury.
Correct.
So we're not talking about, you're playing soccer and you're, on the field and you collide with somebody and you dislocate your, patella or your shoulder or something. We're talking about, either extremely low force or no force. And there's a huge difference, right?
Huge difference. Yeah, because athletes all over have injuries and traumatic injuries and, things that are appropriate for the situation. But yes, these are things that, don't exactly add up to the doctor, or, she wasn't really doing anything. And then this bigger injury, occurs. Yeah. And it's, so I think a lot of people, I hope they're getting, reaching out, seeing the physicians and, getting the diagnosis, right? And then where do you typically say, okay, we have the diagnosis and now we're going to go, X, Y, and Z. Where do we go from here?
So I don't know if you've heard me talk about my acronym MENS PMMS that I use for
share that. Yes.
Yeah. So I developed that a number of years ago. I already was treating people with these conditions, and my husband was like, you need an acronym to kind of describe the way you treat people, and you come up with these comprehensive treatment plans. So he's the one actually who came up with the MENS PMMS.
I love it.
Yeah. And I like to point out that there are 3 M's in this acronym. But the first M is movement. The second one is modalities. And the third one is medications. Because a lot of people think, I'm going to take a pill for that. Well, really, it's movement. And I know a lot of people suffer from post-exertional malaise. And so we have to be very thoughtful and very careful about how we do this. But
the right type.
The right type. But the less we move, the sicker we get, the worse we get. So It's really, really challenging because a lot of people get injured doing very simple things, including me. And when I heard about kinesiophobia, I was like, oh my gosh, that's me. I'm so afraid to move because I'd get hurt doing simple things.
Right.
But so yeah, the movement piece is critical. The E stands for education. So people listening to this podcast, listening to my podcast, reading my Substack newsletter, reading other people's, blogs, newsletters, etc.,
Right.
getting the right amount of education. Not too much, because you have to dose that also, right? If you spend all day, every day, you are going to drive yourself crazy. So you really have to be deliberate about it, be very choosy with your sources, and know when to stop.
Because too much, it's like anything. Consuming too much of one thing is not healthy.
Yeah, exactly. Exactly. The N stands for nutrition. So I can't tell you how many people we've really worked on revamping the foods that they're eating, and it really helps them to feel better. So we can really make a lot of headway often with that. And then the S stands for sleep. The first S stands for sleep. Sleep is critically important, and getting good quality sleep. A lot of people with these conditions have sleep apnea, so we need to be more aggressive with screening for sleep apnea than we would with the general population, and make sure that we are addressing things like, sympathetic activation in sleep. If people are like waking up and feeling like their heart's racing, sometimes taking a beta blocker or something before bedtime can help with that. And then the P stands for psychosocial. So we need to address what's going on in their life, and how can we get them the right kind of support? How can we address the factors that are playing into their pain and their other symptoms, like activation of their sympathetic nervous system and or, trauma and their nervous system feeling unsafe? That can exacerbate all of these symptoms. So PMMS. Okay, and then M for modalities. So that's like, red light therapy, acupuncture, acupressure, TENS. And I tell people the 10% rule, like each one of these things might give you 10% improvement, whether it's a medication or a supplement or whatever. But we're trying to find like maybe 5 things, each of which give you 10% improvement. Rather than thinking like I did back when I was in terrible pain, I just need to find the one thing. I kept thinking, I kept thinking there was one magic thing out there, and I never did. Yeah, I never did find the one magic thing.
Still looking. Yeah, right.
Yeah,
but
still looking.
Think that's just so human nature to be like, I was like, okay, I'm diagnosed with POTS. Where's the magic pill? He's going to give it to me. And it's not. It's this, I always refer to it as like a recipe, but you're finding the right ingredients that work for you, because what works for one doesn't always work for other, but different percentages of each definitely does.
Yeah, that's exactly what it is. It is like a recipe. And what I like about the recipe analogy is another important component of this is time. So sometimes I talk to people and they are so eager to get better. And I get that, like having been very sick myself, and I'm so many, I can't even tell you how many times better I am now at age 61, and I should knock on wood here a second, than I was like in my 40s. I'm so much healthier now, but it didn't happen overnight. It took a long time. It took putting one foot in front of the other, a little of this, a little of that, like you said, with a recipe, and patience.
And I think that's sometimes the hardest part of all of this is, we're all looking, okay, we don't have the magic pill, right? Okay, but if I do this other work, like how quick? And it's a lot of, I joke, I'm type A. That personality is like, okay, I'm going to do it, and I'm going to follow the plan, but it's time. And it's, all of these diagnoses, typically we see them running together. So we're not only, working on the hypermobility piece, but then you're talking about, the tachycardia and the sympathetic nervous system and all these things that were coming together. And it does take time. And that can be so, so frustrating.
Yeah. Very frustrating. Very, very frustrating.
Yeah. And I think, finding the right doctors, finding the right physicians, finding the right education piece to add it in, to arm yourself and be like, fully understand what's going on, but then also kind of be like, okay, this is what I have, this is what they're thinking, and then, how do we go forward? And I think, I want everyone to, you'll have to share where they can find you, but, if you find yourself with these diagnoses, and, or even before that, if you back up and say, this sounds like me, she's given you kind of the plan, and, the different recipe pieces. And again, all you have to remember is what works for one doesn't work for everybody, but a combination of what we're talking about is what the research has shown, and it is what is helping people get better, but everyone's, specific recipe is a little bit different. So if you're, gather, I think we had Dr. Nance on, and I keep referring to her thing, and she always says, gather all the dots, like gather your dots, gather all your info. And
that's
then,
hilarious, because I have her book sitting right here on my desk.
I love her. Yes. I think that's such a good statement. You're gathering all your dots to find, all this great info, and then what works for you from those dots, to really make it customized to you. But where can everybody find you on Instagram and the website and all of the, the things to reach out?
Sure. So I'm on most social platforms at Hypermobility MD, and also on a lot of platforms as Bendy Bodies, but more platforms was Hypermobility MD. And then also my website is hypermobilitymd.com. People can also visit bendybodiespodcast.com.
Yes.
And I also have a Substack newsletter that is very, very active and seems to be very well received. And I really, really like the Substack format, because if I get a new piece of information, or I realize that, I forgot to include whatever, I can actually go back in and edit my post. Whereas it's really hard to do that. Well, you can't, I guess you can do that technically, like on Instagram, but there's no way on Instagram to you can put it at the top, I guess. But on Substack, you can click that button and send an email to everyone, letting them know I just added an update to my post. If you think it's substantial enough, I do that.
Yeah, and it's because there is information coming out all the time,
right?
And things are changing, and I also say, it's like what you're learning in clinic and what you're seeing work more, and that's a way to get to everybody. So I thank you so much for coming and sharing all this great info, and just I think giving people hope that hey, this is out there. This is where I was. Look where I am now. It takes time, but there is hope, and there's a plan, and things can get better.
Yes, absolutely. And that's the thing, is I felt so hopeless for a while in my own journey. And I don't want anyone to feel that, because that's a really bad place to be. And we don't want to have toxic positivity or, artificial hope. But I have had a lot of patients get so much better. Not everybody. I wish I could say that every single person I've treated is doing great now and doing whatever they want.
It's all perfect. Yeah.
Yeah. But that would be untrue. But I've had a lot of people that, like me, have had tremendous improvement.
Yeah, I think it's a lonely place when you hear some of these diagnoses, and you just feel so lost. And I'm the same way. I mean, it's bumpy, right? These are realistic perspectives that it's bumpy, but it can get better. And you're right. Finding your community, finding hope, knowing that there is hope, I think will just go so far. So I can't thank you enough. So remember to like, subscribe, share with friends and family, all the things for the podcast, and we'll see you next time. Bye.